Hi, this is Dr. Ayappan, and today I would like to discuss about shoulder dislocation and pretty easy technique to reduce the shoulder dislocation without using much force, or even we don't require any kind of medications or drugs or analgesia to reduce it. So today I'll be showing the video of a 80-year-old gentleman who had come to me with a dislocation of the shoulder. So he had a fall on his arm, and he felt that the shoulder has come out, and he came with excruciating pain, and he was not able to lift the shoulder and move the shoulder. So now he was brought to our emergency department, where we took an X-ray to documented that he had a shoulder dislocation, and it was basically an anterior or a front-based shoulder dislocation. And the technique I use here is called as a Mills technique, where you can observe that the patient is made to lie down, made comfortable to him. So I'll be talking to him, make him actually very, very comfortable. Patient has to relax his arm and the shoulder, and that's the most important thing in this particular technique. So here, what I do is I gradually take his arm and his hand and take the shoulder out in this particular way. So we call it as abduction, abduction, and external rotation. Gradually stretch it out, and with each stretch, or gradually when we move it, we have to ask the patient to relax. Relaxation is very important. So if we can ask the patient to relax and he relaxes properly, so then gradually what I do is I actually take it out like this. So this way, what I'm trying to do is the shoulder is, so if this is your shoulder, the ball socket joint, it is actually sitting here now. So this is a dislocation. That's a front-based dislocation. So the ball is actually sitting outside the socket. So when I take the hand like this, so what happens is I'm actually pushing the head out like this. So the ball comes out, and once it adequately comes out away from the socket, then I can actually move it back inside very easily. So what I do is take it out like that. When I see that the head is actually coming out significantly over a period of a minute or two, and then suddenly I put it back into its original position.
Very good.
This is a procedure where we actually put the shoulder back. So this is again an anterior dislocation of the shoulder, where the shoulder is slipped, or the ball socket joint is slipped, and the ball is slipped in front of the socket of the shoulder. So what I'm doing here is I'm gradually holding the patient's hand. You can observe my right hand. Right hand is at the elbow. Left hand is holding the patient's arm, and I'm slowly lifting the hand forward and gradually externally rotating, that is rotating it outside. So I gradually will increase the rotation more and more, and the ball will gradually become more rotated outside the socket. Once I've got enough rotation outside, I ask my assistant to press on the front of the shoulder so that the ball slips back into the socket. So this is you can say the last step, where I'm actually putting it back and then falls back into place. Good.